Oh, beautiful. Awesome. Happy planting.
Meet Margo.
I'm Margo Piper, and I'm the development director at Tree Folks.
Margo really loves her job.
Tree Folks! I've been a huge follower of Tree Folks since I was a kid. In fact, the first time I interacted with Tree Folks, I was 7 years old and planted peach trees along Town Lake. Do you guys need some stickers over here? Dun, da, da, da. And it just happened perfectly to align with, a career break for me.
It was a seed of hope sprouted out of a drought of bad luck. Margo was on a break because she was recovering from a fight with cancer, a fight she had to go through with little medical assistance because she didn't have health insurance.
I was playing a time game with myself of how long can I pretend not to be sick to get full-time health insurance, and that I ran out of time.
Margo was just one of millions of Texans without coverage, and it nearly cost her her life. So how did we get here? And if you're someone like Margo, where can you go for help when you don't have insurance? First off, a diagnosis. How healthy is the state's healthcare coverage?
We are an extreme case.
This is Ann Dunkelberg with the Center for Public Policy Priorities.
Texas has both the highest number of uninsured residents and the highest percentage. So it's not just because we're a big state, it's also the highest percentage. So we have the latest census data, which are for 2018, that we had around 5 million uninsured Texans for that year. And that was 17.7% of our population. And the national average for uninsured is 8.5%. So, over twice the national average.
5 million Texans lack health insurance. That's more people than the entire population of Louisiana.
When I first started writing a paper about the uninsured in Texas, 25 or 30 years ago, we had very little manufacturing, we had low organized labor. None of the factors that would tend to drive up a culture providing a lot of employee benefits were there. And of course, employer-provided coverage is by far the number one way Americans get coverage. Now, over the last 30 years, employer-sponsored health insurance has declined everywhere, including Texas.
Y'all want one of these?
Margo had health coverage through her old job, the same job she thought was making her sick.
Living on airplanes, living in hotel rooms, and not having a lot of downtime. I hadn't had a period in over a year. I just blamed everything on stress. My thought was, once I get out of here, I'm gonna be able to focus on myself.
She left her job, but her health did not improve.
What I came across was that doctors would hear me out, and I would ask for a deeper dive, and they would say, well, let's wait until you have insurance for that. They would say, well, you'll live through the weekend. Come back Monday, which eventually, as we found out, was not going to be true at some point. I was not going to live through the weekend. I had a big meeting. Somebody looked down and they said, oh, Margo, I think you spilled some coffee. Then we looked down and I said, oh, I'm so sorry, that's actually blood. It's not coffee, it just happens sometimes.
Margo eventually found a doctor that would take her on without insurance. She was diagnosed with ovarian cancer, and the tumor was growing rapidly.
It was on the verge of what they call a dandelion effect, which means any wrong movement could have burst and the cancer would have spread across my entire body. And I was just up against that timeline. They found the cancer and it had not spread yet, which is a fantastic, that's the best case scenario. I absolutely was surprised by the scenario of walking in, being treated like a normal patient up until the health insurance coverage portion. They would give me, a pamphlet with resources of, here's where you can go to get help, which I appreciated, but I also needed help now.
We are one of only 2 places where in America today, if you are uninsured, you can receive health care and be assured that you're not going to be turned away. The other place is an emergency room.
This is Rhonda Mundhenk. She's the CEO of Lone Star Circle of Care. They're one of the few backstops for Texans without health insurance. She says that there are a lot of myths about the uninsured.
I think the myth that we tell ourselves in America is that the folks who don't have insurance are not working. And the reality of it is the vast majority of people are actually working who are not insured, particularly in cities where there's sort of a heavy entrepreneurial side of business, where there are a number of small businesses still operating in a number of our counties. Those are the uninsured folks that we see. What Lone Star provides is comprehensive primary care services, but obviously if you need specialty care, which many people do for the chronic conditions that they have, that can be very difficult to obtain, depending on whether or not you can pay for it.
For Margo, even having the money to pay for tests wasn't enough to get some doctors to run them.
So my husband and I actually had been saving pretty much 10 years to buy a house. We did end up dipping into it. We had the money right there in front of these doctors, and because there wasn't the stamp of healthcare, they were just unwilling to go there.
Here's where money becomes a double-edged sword. Higher incomes offer a safety net, but having those funds is one of the reasons Margo and thousands of other Texans fall into the healthcare gap.
You qualify for subsidies if you're at a certain certain percentage of the federal poverty level. So subsidies are based on your income from 100% of the federal poverty level to 400% of the federal poverty level, and below or above that, you don't qualify.
Corey Hadimer is with Foundation Communities. Every year, they help people buy insurance through the ACA marketplace and apply for subsidies. But there's a problem. Texans who make too much money to qualify for Medicaid, but not enough to get subsidies, are left with coverage options that are usually unaffordable.
For some clients, it's just understanding, okay, I need to earn this much this next year to qualify for subsidies. And so we do the very best we can to help them get an accurate estimate for this next year. And understanding that, if you think you're gonna make $12,000 and if you earn $500 more, you're going to qualify for subsidies, having that conversation. But if people aren't close to qualifying, then it's a conversation about local options.
So how did we end up with a massive gap in healthcare coverage? There are two big reasons. First,
Texas will not be participating in Medicaid expansion.
Politics.
We've made policy choices that dramatically add to our uninsured rate. We're one of only 14 states now that hasn't done what gets sort of glibly called the Medicaid expansion under the Affordable Care Act. And so we have a Medicaid program in Texas that if you are working poor, there's just not a place for you.
It's just become a hard political sell.
This is Jim Henson, director of the Texas Politics Project. He says the second reason Texans didn't expand Medicaid has less to do with red or blue and more to do with green.
Anytime you're talking about Medicaid expansion in Texas, because of the high uninsured rate in the state and just the number of people in a state as populous as Texas, you're always talking about just big whole numbers, billions of dollars in additional funding. There was just no oxygen and no negotiating room in Texas compared to other states because the price tag was so large and the political climate was so overdetermined in Texas, again, by the rise of the most conservative wing of the Republican Party.
According to the Episcopal Health Foundation and the Kaiser Family Foundation, 2/3 of Texans say the state isn't doing enough to help low-income adults access medical care. But even in an election year, Henson doesn't see things shifting for healthcare in Texas.
Healthcare doesn't really move the needle very much. And Texas has been one of the states leading litigation to get the Affordable Care Act repealed. So there's really no political leverage to say, well, we think the Affordable Care Act is unconstitutional. And they say, but we'll take Medicaid expansion.
But experts say Texas can't afford to stand still. By 2040, the uninsured population will rise to over 6 million people, costing the state an estimated $2 billion.
If we are serious about really creating an opportunity for people to move their way up the economic ladder, we haven't done that until we have a system that provides economic safety for people in the healthcare realm. So that's a huge disadvantage to low-income Texans, and it falls very, very disproportionately on people of color in Texas.
I think Texas is going to have to grapple, ultimately, with what's going to happen with its uninsured population, which means that Texas has to come up with its own solution, yet to be determined.
Oh, the handoff is official.
Today, Margo is doing well, Her cancer is in remission, she's passionate about her job, and yes, she does have healthcare coverage. But she's also aware that with a few less resources, her story might have ended very differently.
It was not a fair system. That was the most disheartening thing, and I know not everybody has the cash in hand to be able to do that, which was also terrifying to think of somebody who really did need the help and didn't have those advocates.